Ladies and gentlemen, a good afternoon to you all. I am Annabel Banda, a lecturer at Gwanda State University in the Faculty of Life Sciences and in the Crop Science Department. Currently doing my doctorate studies at Chinoy University of Technology. I am an entomologist. However, now I'm not narrowing into entomology. I'm more diversified when it comes to research. I call myself a biologist. Anything biological, I can research on. We've written a review in order to contribute in one of the SDG goals, terrestrial ecosystems. This review, it looks at rodents, zoonotic parasites, plague prediction, rodents and flea species in Africa. Some of my authors are Joshua Spanda and Tatenda Manyuchi. The presentation outline will be as follows. There will be the introduction, material and methods, results, discussion, conclusion, and recommendation. You realize that the results and the discussion will be blended since it's more or less like a review. You find that if the health system breaks down, most or more often infectious diseases, they rise up. In most cases, it is as a result of poor vector control systems that are in place in a particular place. This has been written by Chevalier et al. 2004. There are quite a number, or many of these infectious diseases, they share symptoms, thereby having a problem in order to diagnose these diseases in people. So you find that our healthy practitioners, our clinicians are facing a difficulty in diagnosing and giving the best prescription of diseases, as indicated by Holiday et al. 2015. This therefore implies that the true burden of these infectious or zoonotic diseases is not well recorded. It is not well researched on, therefore making it difficult to contribute to the policymakers so that they can come out with informed decisions, or we can carry out a pragmatic control of these zoonotic diseases. Plague disease is one of these infectious diseases caused by bacteria known as Yersinia pestis, mostly being harbored or being found in our rodents. And most researchers have shown that it's mainly transmitted by some ectoparasites known as fleas, therefore being of great public or medical health importance. WHO 2016. It has been implicated, or this disease has been realized that mostly it is a disease of the poor places or poor countries or poor continents such as Africa, South America, India. And in Africa, you find that the Democratic Republic of Congo and Madagascar are one of the countries with the highest prevalence of this disease. And it has been realized that plague disease occurrence, it changes. It's not like when it is found in Congo, it cannot spread to other countries. It can spread. It is dynamic. And the multi-drug resistant Yersinia pestis has been found. Yersinia pestis, this is a bacteria that causes plague. This presentation, therefore, it seeks to highlight some of the rodent zoonotic diseases which occur in Africa, the distribution of plague in Africa and in Zimbabwe, and then the rodent and flea dominant in Africa. Why the interest in the rodents and flea? Because we said that this plague disease, it mostly is harbored in rodents. They are usually the main host or the major host of plague disease. It is therefore important that ecologically we know which rodent species are more abundant or are there in Africa and which flea species most occur in the African continent. This will assist those involved in plague control to know which flea species to target, to know which rodent species to target. We move on to materials and methods. Literature was got from browsers, internet browsers, search engines, databases, use of Firefox, Explorer, MSN, Google, DOAJ, AJOL, web crawler. And then the prediction of plague in Zimbabwe. This was done using maximum entropy, or you call it MaxEnt, a modeling technique. This is used to model the spatial temporal distribution and probability of plague occurrence against the 4 selected environmental predictions. So you find the environmental prediction, you can use temperature, you can use rainfall, you can use the vegetation cover, you can use the soil type. This is then used in conjunction or with the data of plague occurrence among people which has been recorded. And this data was sourced from Nkai General Hospital, being aided by one of the environmentalist officers, Joshua Banda, to get such kind of information so that we can predict or we can model which other places can we expect plague to occur. This is important so that we can put in place practices, or we can put in place ways of controlling this disease. So 1994 environmental data variables were used together with the 1994 data which was obtained from the hospitals of plague occurrence among people, the deaths that occurred, where it occurred, the villages, and the places where that occurred, the wards, the villages that was utilized, so that we can predict which other places can we find this disease. Before we go into results and discussion, you find that mostly I'm putting forward plague disease. Why? It is because plague has been known of its ability to emerge, to come again back to life after years of being quiet. And now we're saying that a multi-drug resistant bacteria that causes plague has been discovered. Therefore, it is of interest that we keep on researching on this particular disease, as it has been known to have caused quite a damaging effect in the continent, worldwide. It has killed or wiped a quarter of Europe long back with the Black Death, all those it was caused by plague disease. During that time, people were not aware that this is a disease caused by bacteria. Hence, many people died, many people perished. Now we're results and discussion. Knowledge gaps on rodent zoonotic disease. Thompson, 2000, states that 2/3 of emerging diseases are zoonotic in nature. 2/3, ladies and gentlemen, they are zoonotic in nature. What do you mean by zoonotic diseases? These are diseases which can be exchanged between animals and people. It can either come from the animals to people or from the people to animals. So this is why, or what we call zoonotic diseases. So we are saying 2/3 of the diseases that can be found in animals can also be found in humans, or they can be got by humans. Of which the wild animals, they are a major reservoir of zoonotic diseases, thereby playing a crucial or a very important role in the epidemiology of zoonotic diseases. So these are some of the invertebrates that are found in rodents, transmitting their parasites or their diseases to humans. Ladies and gentlemen, we have protozoans, which transmit diseases known as leishmaniasis to humans. Humans can get leishmaniasis, but we're saying leishmaniasis is also found in rodents. So humans can get this particular disease from what? From rodents. And with Toxoplasma gondii, also protozoan in nature. Then there are trematodes. These trematodes bring forth schistosoma or Schistoma mansoni, S. bovis, S. matei. Ladies and gentlemen, do mind of some of the pronunciation of the scientific words. Sometimes they are hard, but now we can use your vision to appreciate what we mean by that. So as we can see, these trematodes, things like Bilharzia and so forth, they can also occur or be harbored by these rodents and be transmitted to humans if time or a situation is going to permit. We've got cestode known as Echinococcus montilocularis, which can be transmitted to humans. That is harbored by what? By rodents. We've got bacteria, Yersinia pestis, which results in plague disease, leptospirosis, red bite fever, these are diseases, salmonellosis, tularemia, this disease which can occur in rodents and can also be transmitted to humans. Variuses, a varius that causes Lassa fever, lymphocytic, and choriomeningitis. All these can occur in rodents and be transmitted to humans. Now we move on to plague prediction in Africa. This prediction was put forward by one of our best researchers or prestigious researchers, Nerynix, 2008. Nerynix, using modeling, found out that there are about 45 unique localities in Africa which has been predicted plague occurrence. These found in Central Africa, Eastern Africa, and Southern Africa. Southern Africa having countries such as Zimbabwe, South Africa, all those. Some places were found plague occurrence can occur, but they have never reported any plague occurrence, such as Ethiopia, Nigeria, and the Central African Republic. No plague cases has been recorded before, but this modeling showed that there are high chances that plague can occur. In agreement with NERENEX 2008, the World Health Organization in 2010 also gave a report indicating that about 28 countries reported plague. So we can see that these modelings, sometimes when they're predicting the occurrence of a disease, they can bring forward something which after some years can be found to have been fulfilled or to be true. Although now during COVID-19, the prediction or the modeling did not really come up with true reflection of the occurrence of plague worldwide. Sometimes it can be relied on, sometimes the modeling cannot be relied on. Now this is our prediction with the help of one of our GIS experts, Tatenda Manyuchi. We came out with a prediction of plague in Zimbabwe. This is quite important. You find that in Zimbabwe, plague has been found to occur in Kai and Lupane. This is Matabeleland North. As I highlighted earlier, plague disease is not stagnant. It doesn't mean that its occurrence in Matabeleland North, it only occurs in that particular place. Any place can have plague. Since these rodents, they move about. There are quite a number of effects that can cause a particular disease to move from one place to the other. And there's this aspect of climate change that is always being preached about. You never know, maybe what used to allow plague to occur in Matabeleland North has now shifted to Mashonaland West or Mashonaland East. So we should be we should be much aware. Hence, science or research has to help us. So this prediction highlighted that some of these provinces, plague can occur in them. They have higher chances of plague occurrence. Mashonaland West, Masvingo, Midlands, and Matabeleland South. These are some of the provinces which we should always having a plague team in place, just waiting for plague occurrence. You never know when. Now we'll move on to the dominant rodent and flea species in Africa. This particular section is quite important. As I highlighted prior, that plagues host or main host or major host are rodents. So we're very interested, either there's the myriad or we call them murid rodents or which type of rodents, but we have to appreciate, as researchers are putting forward their research, we now write and compile information to appreciate which rodents are more abundant or which rodents occur in Africa, which flea species are more abundant or are being recorded by the researchers in Africa. This will assist us to have a pragmatic approach in control of plague disease, to know which rodent species we are going to target, to know which flea species we are going to target. Mastomys natalensis and Rattus were one of the dominant rodent species which were found to be more abundant in Africa, followed by Gebilarus species, Crocodile species being the second dominant rodent species, which were found by researchers in Africa. Remember, this is a review. A review utilizes some researches which has been produced by other people so that we compile the information. Ladies and gentlemen, we are seeing Mastomys, natalensis, and Rattus being the most dominant and were one of the most abundant rodent species being recorded by researchers in Africa. There is therefore a need to control the population of these rodents. There are higher chances that these rodent species, they can be implicated or they can cause plague disease transmission. And Mastomys natalensis is one of the rodent species which has been found not to easily succumb to plague disease, not to easily succumb to Yersinia pestis bacteria. Meaning that it can flourish, its population can go high and not being destroyed by plague, but transmitting the disease to other animals and to people. So there is need to control the population of this rodent species. And then we move on to the dominant flea species. It was Xenopsylla brasiliensis, Xenopsylla chaopis, Xenopsylla lampasas. Ladies and gentlemen, I'm sorry about the wrong spelling. That is Xenopsylla, not D-O, but D-I. And Tenophthalmus species. This flea species, which was found to be more dominant, especially Xenopsylla brasiliensis. Xenopsylla brasiliensis, it has been indicated by some researchers back who looked at fleas, at flea species, the characterization of flea species, that the Xenopsylla brasiliensis mostly occur in Southern Africa. Ladies and gentlemen, there is need to always keep in place or to control these flea species that are more dominant or are most, they are occurring in our African continents. So you find some insecticides to destroy them. The approach of controlling this plague disease can either be one can control the flea species themselves, since they are the ones which have been observed to transmit the disease more faster or more actively. The other way that we can control this particular disease is that we make people aware of this particular disease. We make people aware that it is not good to capture and consume rodents. In case that one has captured and consumed rodents, make sure they are well cooked. You find that rodents are a delicacy in the African continent. Therefore, we cannot stop people from eating rodents, but make sure you prepare them very well. People, they reduce transmission of blood from the rodents to people. This should be minimized. When they are preparing their delicacy, they should not come into contact with the rodent's blood. People should reduce, they should reduce coming into contact with the rodents at all costs. But we find that due to our way of living as Africans, we cannot do away with the bush. Make sure people are well clothed. They put some gumboots, they put safety shoes, ladies and gentlemen. They are well covered so that they reduce fleas attacking them or fleas feeding on their blood. These fleas have been realized that if the rodents die, they can feed on any other organism because they want blood. So that is why it is important that people cover themselves when they are in the bush. They are well covered to reduce the occurrence of plague disease. We move on to the conclusion. This review concludes that rodents, they quite, ladies and gentlemen, rodents, they harbor a number of parasites that causes disease to humans. We realize that rodents can have protozoans, rodents can have bacteria, rodents can have viruses, rodents can have trematodes. Plague modeling. it showed that Africa or Southern Africa is more prone to plague disease. Southern Africa, these are, Zimbabwe is one of the country. Ladies and gentlemen, we are in danger. Therefore, we should keep an active surveillance of this plague disease. South Africa is one of them. Zambia is one of them. Botswana is one of them. All those countries in Southern Africa, they should be well aware that plague can occur or can hit them at any time. In Zimbabwe, plague disease was predicted in Matabeleland South, Matabeleland North, Mashonaland West, Mashonaland East, Bulawayo, Midlands, and Masvingo. This, therefore, is a wake-up call for everyone that plague that is not only occurring in Matabeleland North, as in now in most books or in most literature, it indicates that Nkai and Lupane, they are non-plague endemic areas in Zimbabwe. All those provinces shown by the model that plague can occur should be on an active alert. An active plague surveillance system should be put in place as indicated by the World Health Organization, that each and every country should have such an active plague surveillance system in place. The dominant rodent and flea species found were Mastomys, natalensis, and Rattus. And then the flea species, it was the Xenopsylla species, Xenopsylla brasiliensis and Xenopsylla chaopis. With not much to say, ladies and gentlemen, I'm not going to take you far, but now what I can say is that as Zimbabweans, let's keep an active surveillance system of the plague disease. Yersinia pestis has been found to have developed a multi-drug resistance. Therefore, everyone should be on the alert. Everyone, the health system, as in the academic sector, we should be interacting with people we live with. We make them appreciate and know that plague is there and plague occurs. I thank you.